Just 3 months since Kenya recorded its first coronavirus case, and the number of cases in the country has continued to spike, with most quarantine facilities struggling with congestion. This has led the government to opt for a home-based quarantine protocol for asymptomatic patients, a new concept that has left Kenyans with many unanswered questions. David Bayer, an infectious disease expert, takes us through what a home-based quarantine is and the resources one requires in order to make their home a standard quarantine facility.
A good home care kind of isolation will need to have a room which is separate from the rest of the family, where you'll have your own toilet, you'll have probably a way of getting your food into the room without getting in contact with the rest of the family. Because if you get contact with the rest of the family, you spread the COVID to them.
Lois Wanjiku, a home care nurse, says a home-based quarantine requires a certain level of discipline and cautiousness, as a small mistake could lead to the spread of the disease to the entire household.
About separating the equipment that this patient is using. If it's cutlery, they have to use separate from what the rest of the family is doing. We are talking about separating things like towels. If it's their linen, it has to be separated. It has to be washed separately.
According to experts, lack of adequate civic education to the public could lead to a total failure of this protocol.
Home-based care protocol is possible to implement it, but it requires a lot of discipline. And at the same time, we have to really understand what this protocol gives us. So one of the things is we have to be given guidelines, and these guidelines can be given by the Ministry of Health, where we are told what is expected of the patient. What does it mean when they go home and they are told you cannot leave your room? At the same time, we have to have guidelines to the caregiver. We are talking about a health caregiver or even a relative taking care of the patient. We also have to be given guidelines on how to take care of the environment that this patient is in, or even how to take care of the rest of the members who are living with this patient.
Among Kenyans, fear of home nursing COVID-19 is clear. Many are now asking the government to find an alternative way of dealing with congestion of COVID-19 patients.
Kwa tricky kidogo kwa sababu huyo mtu lazima atatoka nje, maybe anataka kwenda haja ndogo ama haja kubwa, hata kama ni kama hizi apartment, lazima atatoka nje, unaona, na ataona hii kitu, maybe hata notice haraka niko na hii kitu. So the more anaendelea kutembea kwa hiyo compound, the more ana spread hiyo ugonjwa.
Wakiachilia wagonjwa wakae kwa manyumba jinsi nilisikia wakitangaza, hiyo ugonjwa itasidi na huenda itapita na sisi wote, hatutaiweza kudhibiti. Kwa hivyo kile ningeona serikali ingefanya hivi, ingejikakamua.
Despite the home-based quarantine protocol being implemented in other countries, the question on whether or not it will be a success in the country remains unknown, and only time will tell. For TV47, I'm Zainab Mohammed.